What happens when a patient and doctor don't agree on the risks of taking a psychiatric medication? My name is Dr. Ruth Dutton. I'm a board certified adult psychiatrist, and I talk a lot in this app about the importance of providing full informed consent when starting psychiatric medication, which looks like weighing the risks versus benefits of taking a medication and weighing the risks versus benefits of not taking a psychiatric medication and making a shared decision based on what seems to be the lowest risk and highest benefit option. Now, I've talked in other videos about what happens when we don't agree on the risks of stopping a psychiatric medication, that in general, unless there's an acute safety risk, that the patient has the autonomy to decide to not take a psychiatric medication. And that I would rather them do that under my guidance in a safe way than on their own just stop it abruptly, which is setting them up for failure. What about the opposite side of the spectrum? When a patient thinks that the potential benefits of a medication are higher and the potential risks of a medication are lower than I think. And this came up recently during a patient visit where basically the patient really wanted to start a medication that I didn't think was safe for them. So in these situations, it's a little different, right? I'm not forcing the patient to do anything. They're requesting something of me. And while my role is to not be a gatekeeper in any way, it is to make sure that I am presenting safe and reasonable options for treatment interventions. And so there may be times when the intervention that the patient wants is not on the table for me. Whether this looks like starting a stimulant or a benzodiazepine or an antidepressant, if it's not a situation that I think is safe or reasonable for the patient, then I'm not going to present it as an option. If they bring it to the table and present it as an option, of course, we're going to extensively review the risks versus benefits of taking the medication and not taking the medication, but ultimately, I may have to say no. And I know that this may ruffle some feathers, but I have to use my wealth of knowledge and expertise that I've gained from my education and my clinical experience to keep my patients safe, right? Do no harm. That's our commitment. But do I think that it's reasonable for the patient to request these things and to want to get relief from their symptoms? Yes, absolutely. And so in these cases, if a patient disagrees with me, I validate their concerns and I do encourage them to get a second opinion if that's something that they're really interested in. I take no offense to it, and perhaps someone else would have a different perspective. But there are going to be situations that I have to say no, and that can be a tough pill to swallow. No pun intended. What about you? If there's been a situation where you really wanted to start a psychiatric medication, but your prescriber said no, how did you navigate that? What was helpful? I'm also putting together an email list for those of you who are interested in my content because I may have future courses or offerings, and I want to be able to communicate directly with you all about those things. So if that's you, then send me a DM with your email, and I'll see you in the next one.